purpose of this video is to provide supplemental instruction in Swedish massage techniques. We will present this video in a series of lessons as they are demonstrated in class. Before we begin, we need to make sure that our environment is warm and inviting, that all of our sheets and linens are clean, and that the room has soft lighting and soft music playing. We also need to make sure that the table height is correct for us in relationship to our client. One of the ways to gauge table height is to graze your front knuckles over the top of the table. Another way to gauge table height is to make sure that if your client is a thin individual or smaller framed individual, that the table height is higher. And if they are a thicker gird individual, that the table height is lower. That way you protect your body using proper body mechanics and table height. Another consideration is placement of our bolsters. We want to make sure that the head bolster is a rolled up towel and placed at the head of the table for our client's head, a pillow for our client's chest when they are lying in the prone position, and an ankle or foot bolster at the end of the table. Before we begin our massage, we want to make sure that we gauge pressure with our client. I usually say to my client on a scale of 1 to 10, if 10 is excruciating pain and 0 to 1 is next to nothing, in Swedish massage, we don't want to be above a 5.
We will be following a 3-stroke rule for each movement. This is for demonstration purposes only. How many times you will use each stroke will depend on the individual needs of the client. Let's begin. Remember to always drape appropriately to protect the privacy of the client. It is important to center yourself and ground your energy, and you can do this by rubbing your hands together to warm them before touching your client, and try not to break contact. Hold your hands slightly above the skin and feel the energy emanating from your client. This may feel like a pulsation, warmth, or vibration. Once you've connected, you'll apply the oil to your hands, never directly on the skin of the client. Now it's time to begin the first lesson. Lesson 1, Seek Healing and Generate Positive Energy. We're going to begin the sequence on the back by warming up with long gliding strokes, which are called effleurage. These are used mainly for warming up and assessing. Effleurage strokes are used on all parts of the body, and the movements are in the direction of the muscle fibers and usually toward the heart. Deep effleurage is used in moving body fluids such as a lymphatic drain. Effleurage is good for lengthening muscles and working into the muscle layers. The focus of effleurage is length and direction. Now the second stroke will begin with fanning out over the back, up to the shoulders, and up the neck. And we're going to do this about 3 strokes just to give you an idea of what we're doing. This is really good for assessing and warming the body up, getting used to the touch of the therapist. Remember to use your body mechanics. Apply most of your weight to the back leg. Now we're going to move on to the third stroke. And Patty is applying more oil. This Joe's back's a little dry here. So we're going to keep the lubrication going so there's no irritation to the skin of the client. Now we're going to go up to the head of the table, and we're going to cup the neck, and we're going to glide down the shoulders. Now there's 3 different ways that you can do this. Patty's using her palms. You could also cup the neck by putting your hand in a C kind of cupping motion, or you can use your knuckles. Whatever is most comfortable for you as the therapist. They all feel good to the client. Now we're going to move to the side of the table, and we're going to thumb up the neck muscles and work those deep neck muscles in the back, the posterior scalings, the splenius, capitis, and cervicis muscles. You'll learn more about those later. We just want to give some nice deep strokes into those deep neck muscles that seem tight and tense on almost everybody. Once we've applied this fingering and thumbing motion, we're going to wring the neck. So this is a nice relaxing cool down. It goes cross fiber over most of the muscles of the neck. Now we're going to go to the head of the table again. And we're going to do some compression strokes down the sides of the spine. And we're going to vibrate up the sides of the back on the return. These are compression strokes. Compression strokes are pressure strokes which push muscle against the bone to spread the fibers of the muscles. Sometimes no oil is needed when using compression, although sometimes oil is used. The focus of compression strokes is to create space between the muscles. And remember, it's very important to do a nice return connecting stroke so the client feels like it's a fluid motion to the massage. Now we're going to do some circular friction up the side of the spine with the thumbs. Notice that Patty is not losing contact with the body. She's taking one stroke and flowing it into the next. Now the friction is a short, deep stroke using the fingers, thumbs, elbows, or heel of the hand. The therapist's hand is on the skin but is actually moving the tissues underneath. There are 3 types of friction: direct pressure, circular friction, which is what we're doing now, and cross fiber friction. The focus of friction is to loosen up subcutaneous scar tissue and fascial adhesions. Now we're going to be moving to the side of the table, and we're going to be petrissaging the scapula area and mid-back. You might better know the scapula as the shoulder blade. Petrissage is a rhythmic kneading, pressing, rolling, lifting, or squeezing of the muscle tissue. Using the whole hand and the fingers, the muscle tissues are lifted away from the bone and the other muscles to create space and warm up the area for deeper work. Now we're going to be moving to the opposite side to do the opposite scapula. Petrissage is classified into 2 categories: superficial and deep. The focus of petrissage is a multi-dimensional draining of tension. The next stroke that we will be going into is the forearm compression from the lower back up to the shoulder on each side. Notice how Patty has worked right down into the next stroke so she hasn't interrupted any kind of flow, and one stroke flows to the other. Patty's using her forearm and she's lengthening and stretching. And we're going to do 3 strokes here to show you how it is and how you go from one part of the stroke to the next to connect. It's very, very important to keep the fluid motion and the continuity of the massage going. Patty's using her body weight, not her forearm, to create the pressure. It is important to use proper body mechanics when performing these techniques so that we can take undue pressure off the low back, the upper back, the hands, and the fingers. Now we're going to move down to the sacrum, and we're going to work around the sacrum with circular friction. This can be done in several different ways. What we're trying to do is loosen up the fascial adhesions that are underneath the skin and create so much tension on the low back. You can use your fingers or your thumbs, or you can use your knuckles. Whatever feels comfortable for you. Now we're going to go into push, pull, and wring the sides. This is the petrissage kneading kind of effleurage motion. And this is a nice finish. Go all the way up the back. Push, pull, and wringing the sides. It grabs the attention of the whole back and relaxes the whole upper and lower back area. Feels really good. Now we're going to do something called tapotement. This is a light, gentle tapping or hacking, a pounding, percussive movements. The focus of deportment is to create a gentle, resonating awareness. Now we're ready to end lesson 1 in the sequence, and we're going to go into a gentle rocking motion. And this is because when you give them a Swedish massage, the body rhythm is kind of put out of whack a little bit. So you want to gently bring them back into their own rhythm. Plus it's just a nice relaxing way to end the sequence. That's the end of lesson 1. Before we move on to lesson 2, we're going to drape the area that we just worked on so that the client stays warm. Now we will begin lesson 2, the gluteal region. Everyone has tension and stress in this area, so this feels really good. Although it is essential to the flow of the massage to work the gluteal area, some clients may not wish to be massaged in this area, so it is important to ask for permission.
Joe, may I work on your glutes?
You may.
Thank you.
Some clients may prefer to move all of their clothing while others prefer to leave their underwear on. We will demonstrate both methods. The first demonstration is with the underwear on. We will drape this area by rolling up a sheet and providing a minimally exposed area so that we have a lot of surface area to work on. We're going to warm up the area with some palm compression. Once we have that area adequately warmed up, we're going to go along the iliac crest and we're going to glide the thumb and work our fingers and thumbs along this iliac crest and vibrate to cool down. This is an area that holds a lot of tension from the low back, so this feels really good. Once we've done this, we're going to do some circular compression with the loose fist. This really kind of loosens up the whole area. And all those 6 deep lateral hip rotators. Okay, now we're going to do 3 horizontal lines and 3 vertical strokes with our elbow. So we're going to do the vertical stroking. 1, 2 toward the middle of the cheek, and 3 to the lateral aspect of the gluteal muscles. And now we're going to do 3 horizontal strokes. 1 at the top, 1 in the middle near the piriformis, and the last at the gluteal fold. Now we're going to cool down with a light vibration. And now we're going to demonstrate the other side without the underwear. Having asked for permission, we are going to start this session with the skin exposed with effleurage. We're going to warm up the area with gentle effleurage. This takes a lot of tension out of those 6 deep lateral hip rotators. Feels really good. Now we're going to glide the thumb along the iliac crest and again vibrate to cool down when we're finished. Usually about 3 or 4 times along this area is good because of the stress and tension is located here because of the low back muscles, referring pain to this area. Now we're going to do some loosed fist compression. Really loosens all the tension and stress in those 6 deep lateral hip rotators. We're going to be moving into 3 horizontal and 3 vertical strokes now. First we're going to do the vertical strokes. Now we're going to be doing 1 in the middle and 1 near the lateral edge of the gluteal area. We're starting with the horizontal strokes right at the gluteal medial area. The second stroke will be near the piriformis, which is located near the center. And the last will be at the gluteal fold. Now we're going to use some gentle vibration to cool the area down. And we're going to redrape the area, and we're done with lesson 2. Moving on to the posterior legs. Now we're going to go for lesson 3, the posterior legs. It is important that we show you our proper draping procedures. What we're trying to do here, notice that Patty has rolled the sheet up, and she is going to lift the leg and pull the sheet back underneath so that we have a professional barrier which we will not go past. It makes the client feel very secure as well. So we're going to begin by, of course, doing our effleurage warm-up. We will start from the ankle, slowly moving through the calf, using lighter pressure over the knee, the back of the knee, back into the gluteal fold. And we want to come back down with a nice connecting stroke, a nice light connecting stroke. And we're going to show you about 3 strokes of this. We're just going to nice light effleurage all the way up the back of the leg. This feels really good. It's very relaxing for the client. Making sure to assess all the way for any tight areas all the way up the back of the leg. Notice how Patty has a nice connecting stroke coming back. Patty's not using really deep pressure, but she is using firm pressure, going all the way back up into the gluteal fold and coming back down with a nice connecting stroke. Now we're going to use a hand-over-hand method, and this is for a lymphatic drain. This helps move the lymphatic fluid through the area. Remember that the lymphatic system does not have a pump to push the fluid uphill, so it moves rather slowly. So by doing this, we are moving the lymphatic fluid 3 times faster than it would normally move. This is a nice deep pressure. We're only going to do this stroke maybe once a month on your client, or as needed. If they're feeling sluggish, just not feeling quite right, they need a lymphatic drain, and this is how we do it. We normally would use a hand-over-hand method, but not as much pressure. It also releases so much tension out of the legs.